Multiple myeloma may not be a common type of cancer and can easily pass as a silent type of blood cancer. The story of Nahashon Kipruto, a resident of Uasin Gishu County, personifies this assertion. From a backache that developed after a motorbike ride in his village to what a diagnosis would eventually reveal as multiple myeloma.
I was going home, I used a motorbike, and probably the road was bumpy. Then I had some pain from this side of the rib. Then I thought it was just something which is going to just be off for some few days. So after some time, I came back to town because it was at the rural areas. And then I came just to some painkillers and just went home. So the pain persisted until I just decided to go to one of the hospitals around town here just to know what's happening.
Kipruto says initially he thought the backache was a result of fatigue, but that's not what rigorous tests would later reveal.
After doing the blood test, after now using the scans, the CT scan and the x-rays, then he gave us just a preliminary, like, for me, I suspect it could be this thing. Yeah, but it was just like, before I give you a full information about this, let's now do another final test. So we had to take my blood and then taken back to Lancet, and then it took about 5 days. And then when the results came, it was like, okay, I had already briefed you, like, it could be this condition called multiple myeloma, or it's a leukemia. So he gave us those options.
You can almost call it a silent type of blood cancer because we don't get to hear about it a lot.
Dr. Bitrus Meli, a hematologist at the Moi Teaching and Referral Hospital, underscores Kipruto's experience as she explains that multiple myeloma is a blood type of cancer that begins in plasma cells, white blood cells, and over time, myeloma cells collect in the bone marrow, forming tumors in many of the body's bones.
What a special type of cell called plasma cells, and these plasma cells fill the bone marrow where blood cells are being produced, and in that way it impacts the process of production of all the cells of the blood, and then there are also other ways in which it impacts disease in the body.
The hematologist says the suspicion index for multiple myeloma among members of the public remains low, and that contributes to late diagnosis when myeloma has taken effect in the body.
Multiple myeloma, you need to have a high index of suspicion. You need to think about it for you to start looking for it. It's not like like a breast cancer where you have a breast lump and you can be able to feel it. Multiple myeloma has no way of saying I'm here.
Myeloma ranks the second most type of cancer at the Moi Teaching and Referral Hospital after lymphoma, and manifests mainly in men above the age of 60 years, but there are also cases in younger generation.
Our youngest patient actually was 26 years of age. I think currently he's in his 30s. So we are not just saying it is common in the older population, but we are seeing that age coming down.
Kipruto says he has accepted his condition and focuses on managing it, even though he acknowledges it has not been a walk in the park.
So I found some good team from the myeloma program. This team is so helpful. They give you information. We have even some social support system. We have a group, a WhatsApp group. So we really encourage one another.
Ebi Tanoi, a caregiver at Ampath MTRH, emphasizes the need to have patients diagnosed with multiple myeloma go through counseling.
Primary care should be psychological, mental wellness. You talk to the patient and help them get to a point where they treat this as a condition that can be managed. It's not a death sentence. So once they settle that in their mind, it becomes easier to handle the other things that may come along with that.
According to the doctor, the novel therapy program established 13 years ago has significantly helped to manage the disease, but with a handful of hematologists and lack of capacity for referral facilities to undertake diagnosis remains a challenge.
Patients are about half, about 250. Meaning that we've lost almost half of the population because of the care gaps that we were talking about. So we are that's why we are coming out in this March, so that we can be able to close the care gaps and improve the outcomes, so that we can be able to reach where the rest of the world is right now, in terms of diagnosing it early and improving the survival outcomes for multiple myeloma.
For patients like Kipruto, they plead with the national government to alleviate the cost of managing multiple myeloma. Timothy Simwa, K24, Evening Edition.